Hey everyone, today I am so excited to welcome Dr. Brita DeStefano from Progress Through Play. Brita, welcome to the families of YouTube and the YouTube channel. Can you tell us a little bit about who you serve, what you do, and how you can help?
Absolutely. So I'm Britta. Thank you so much for having me. I am a pediatric physical therapist and I have a practice called Progress Through Play that serves basically the greater metro Denver area. And I focus mainly on young infants, basically from birth through walking at this point. And I am super passionate about supporting the whole family and kind of promoting developmental wellness is kind of what I call it, but being proactive about supporting our children's development.
Yes, I love that. I have such a special place in my heart for educating parents. I think, generally speaking, there's so much both to learn as parents, but also so many ways that we can help educate them and make it a little bit easier. So, what is your favorite thing to help families learn about that magical space between birth and walking?
I think my favorite thing is helping parents actually to shift their mindset around milestones and development and teach them about getting curious about their baby's development and milestones and really celebrating every little step, the little mini milestones along the way so that they don't get caught up in the milestone anxiety and just waiting and waiting for the next big checklist item to happen, and instead noticing and getting really observant and excited about all of the small stuff along the way so that they can really like enjoy the journey and enjoy their babies. A lot of the parents who come to work with me are a little bit stressed and anxious and feeling as if, because if my baby's lagging behind or has a diagnosis of some sort, I have to be playing physical therapist with them all day long. Like, this is now my job. You know, I spend all of baby's wake windows doing work, work, work all the time. And I want to help them find that balance of still continuing to get to enjoy being a parent, let their baby enjoy being a baby, and just take some of that stress off of their plate.
Absolutely. One of my favorite things to talk with parents about is tummy time, because we know as pediatric physical therapists that it can be such a huge pain point for parents, but
Yep.
also it truly is one of those milestone, like base foundational skills in order to do all the other bigger, maybe more glamorous skills down the road, like rolling, crawling, things like that. What is one tip that you could give the families of YouTube about tummy time that kind of maybe are either Googling you because you're so famous or looking for pediatric physical therapy tips in the Denver area?
I think my biggest thing that I impart when I'm helping parents with a baby who, say, is like struggling with tummy time, maybe is not currently rocking it, and you're a little bit worried about that, is that it's okay for us to modify it to help your baby be successful. Because I feel like parents are a little bit afraid of switching it up or trying new things because in their mind, tummy time is just like flat on the floor, you know, baby plank, like see how long we can hold it. Let's watch the clock and like time them. I'm like,
Mhm.
okay, but like, can we make it functional? Can we make it fun? Can we like switch up the environment? Can we add things to help them be more comfortable with obviously the end goal being that we get to them flat on the floor, pushing up and like reaching those tummy time milestones. But like, I give them permission to do basically work with their baby in a way that makes it a productive activity instead of a stress inducing one, if that makes sense.
It totally does. And I love it because the biggest thing is like, okay, I feel like families just see rolling or they just see tummy time. And like you said, kind of in the beginning of the interview, is that there are so many like road signs, like pit stops along the way. You want to get out, stretch your legs. So maybe the difference between tummy time flat on the floor is like a slight incline or an elbow position, or taking a little bit of stress off that upper trunk so that babies can push through their elbows. And maybe that modification is so short that they only needed just a little bit of extra time to build up that strength to then make that next position or that next leap into the slightly more difficult position of tummy time, and then really breaking down those movements so that the baby can be successful the whole time up to kind of where that end goal is.
Well, and like you mentioned, you know, we're always doing the elbow scoop or like pulling back on the pelvis. And sometimes the parents are just nervous about being hands-on. They don't realize that they can do that. They think like, I set my baby down in tummy time and then I'm like, okay, you know, my job is done. And, you know, it can also be so helpful in like regulating your baby's nervous system to be hands-on with them and to be close with them. And so just empowering parents to have that, you know, sense of comfort with the touch and like helping their babies, like you said, with just little positioning tricks that we know, you know, are insider things that are, you know, second nature to us, but can really seem like rocket science to a parent who's like, oh my gosh, of course it's easier if I offload, you know. And it's simple things like that that I feel like can be so majorly helpful.
And I think too, you know, when families go to like their well visits with their physician, they're trying to look at so many different things. So if families are noticing that something is difficult, there is so much more potential in things that they can learn that can make the process of a baby's movement so much easier. But maybe, you know, the education out there, and I think that's on us as physical therapists to like really bring out the opportunity that we have as a profession to these families and say, hey, like, we're here for you. We're here to empower you. We're here for you to learn a couple of different things, but really not necessarily like steamroll your whole life, really make it functional. So the whole experience of your baby's development becomes a more gentle, nicer experience.
Yeah. And I tell parents that, you know, the education that I'm providing to them is truly going to help them form a deeper connection with their child. They're going to have more like empathy for all the stuff that is going on when I'm like, no, I know that like we're working towards rolling, but like, did you know that X, Y, and Z and all this other stuff is happening right now too, like developmentally? And they're just like, oh, well, no wonder their sleep is so bad this week, or no wonder they've been kind of fussy. And it's like, it just helps like connect the dots a little bit for them, and just create those deeper connections because they have ways to engage with them purposefully and intentionally. And they can sit back and really watch with that curiosity, like we talked about, to learn more about their own babies along the way.
One of my favorite things to tell my doctorate of physical therapy students is that we see how these kiddos are moving in a way and through a lens that parents have not necessarily been taught to see their child. So we're watching all these little pieces of movement come together, and we can point out those little wins and say, okay, now we've mastered this. The next step is this, and then the next one is this. And then, you know, we're this close to this next big milestone, when for a lot of times families, like, it can be really frustrating because they don't have the knowledge or the lens to see that. And so what a huge gift we are to be able to bring that to families, and with it, a lot of hope too, especially for families with a kiddo with a diagnosis that maybe they're really, really unsure of how their child's movement development is going to occur.
Yeah. And I love really cluing them in to that like aspect of the foundation and how motor skills build upon each other. So like when we're working on something, I talk about how that progresses and how they're going to use that movement later on, just so that they can, again, kind of connect those dots and be like, oh yeah, that is really important. I do want my baby to be able to do that down the road. So yes, let's work on that leg flexion now so that, you know, whatever it may be. It's just kind of nice for them to step back and see that bigger picture when they've just been like, in the weeds of working on something that their baby's struggling with. It's kind of cool to get to see how it will all come together in the end.
What other areas do you really see families or kiddos struggle with on the path to walking that you really help them navigate?
I would say my biggest patient population at this point is babies who are what I call my stuck babies, meaning they're having some problem with moving. So our babies with a diagnosis of torticollis or oral ties, tethered oral tissues, or just general tense babies. I'm really, really passionate about being proactive with them in terms of creating positive movement opportunities for them. These babies are really uncomfortable in their bodies, and I think they deserve to feel comfortable, and movement is the way that we can do that for them. It's kind of powerful when you think about it that way, right? That our babies don't have any other way to communicate with us. And when we look at the clues that their bodies are trying to tell us, maybe it's that baby that's really stiff and arches a lot and has all that extensor activation. That's a way of them communicating. It doesn't feel good for me to move my body in the opposite direction. And often these babies get like zero rotation because they are so stuck, and so I just love getting in there, and I use all these analogies with my families, but I'm like, it needs to be like a well-oiled machine, and motion is lotion, and we're really like priming their bodies to feel good moving in all these different planes. And then I have my rotisserie chicken analogy about how we need to cook them on all sides. I'm apparently really big on analogies with my patients, but and I had a family that I was working with recently where the dad does yoga. And so he was really like stuck on like, what specific one muscle stretch do I need to be doing and how many times a day? And I said, I want you to take a step back and think about it this way. Like, are you going to get better if all you ever do is one yoga pose, the same yoga pose, just over and over again? And he was like, well, no, like I do an entire class with a flow and different poses. And so I was like, I want you to approach your baby's therapy that he's doing throughout the day like an entire yoga class, right? We're addressing the entire body. I want the whole body to move well in all directions, not just maybe in our specific direction that we're prioritizing right now, but just how helpful movement in general is for everybody across the lifespan. So why not start with our infants and make sure that they're feeling good about that?
Well, and I think that's so, so important because we, for so many years, have looked at the developing child from a neurological standpoint. And that's really great, right? We want babies to be able to plan their movement, be able to recruit muscles from a neurological standpoint. So for the families of YouTube, your brain sends signals to the muscles turn on and off based on those signals, and then you're able to do things like coordinate reaching or push through the ground in order to get into all fours, things like that. Now, I feel like I get chills even just thinking about it because I'm more of an ortho-based therapist where I see how the babies move, and I love treating patients and babies and educating parents on optimal movement because from the birth to 3 range, you are setting the foundation for everything else. And so if we are just setting the foundation for movement, what are we missing out on? And what are we unintentionally making more difficult for these children in their academics, in regulating their nervous system, and being able to focus that we could easily, intentionally shift during these early years?
Yeah, absolutely. I mean, if we have the opportunity to intervene early and provide more optimal functioning, who would not want to do that? Because it is like, yes, you can go and you can check off the boxes that your pediatrician Like, yes, my baby can roll. Yes, my baby can sit, but like, what is the actual quality of that movement? Can your baby only roll to the right side? And if you ask them to roll to the left, they're like, no, thank you. You know, when we get to dig deeper, that's the thing that we are so lucky, I think, as physical therapists, and specifically in the setting that we're working in, to get that time. And I always tell parents that I feel like a detective, because yes, you may go to the pediatrician and say, well, my baby hates tummy time. And the pediatrician says, well, you should do more because that's going to help them. And I'm like, no, I want to figure out why. I'm like, we're going to go through, I'm putting my detective hat on. I want to find out the why for all of this, like the root cause, the reason. You know, we're not just going to slap a Band-Aid on this and tell a stressed out parent to just do more tummy time when their baby's already struggling with it. Like, that is the absolute worst advice, I feel like, because it is so triggering. Like, if you are a parent out there and you have had a baby who hates tummy time, and maybe you're a little bit on the anxious side already, like I was as a parent, oh my God, like that can just send you spiraling. Like your baby can truly, like, your baby's development can affect your mental health as a parent. And so if we're not fully supporting that parent to understand, what are your baby's needs? Why are they struggling? What is it that we can do to help make them more successful? So it isn't this like stress inducing, now you're completely avoiding it type of activity. And your pediatrician doesn't have the time to do that. That's nothing like, nothing negative on their part. That's truly just how medicine works. And their appointments are like 10 or 15 minutes long. We get an hour with you. And I'm so lucky to be able to get to do that. And, you know, patients ask, why are you cash based? And truly it is because I am giving you a full hour of me, and then full access to text me whenever you want, send me videos, ask me questions. And I want you to, like, I tell my families, please send me updates. I want the pictures of like the success story the first time they sit up or whatever it may be, even if we're not working together anymore. I'm like, please, please. This is my favorite thing about my job, is getting to see the impact that I get to have on families. And so I just think, I always tell parents, if you have a question that's nagging you enough to go Google it, just call a PT instead. Because you deserve to have the full answer that is tailored to your specific child, and not some arbitrary thing that you'll find on a scary Google search. And so I say, I want to be your Google. Write all your questions down. I have some families where I show up and they literally pull out their phone and they're like, okay, hold on, let me go find all of our questions since we saw you last. And I love that, because it's a lot less scary. It's a lot less daunting when I can say, oh, well, I know baby Alex and I know how he's progressing. And so to answer your question relative to him, this is what I would say XYZ is normal, blah, you know. And so I just feel very lucky to get to practice in that way.
Well, and I love that too. And that's one of the reasons why I am so deeply passionate about bringing PTs on the YouTube channel, is obviously I want to make as much PT knowledge that is safe and effective available to these families for free, but it's not individualized, and it couldn't be individualized. And there's going to be a point potentially with certain families, or in every family's journey, where they're going to be like, okay, this one video is like really great, or this playlist is really great, but I'm struggling. My baby's really avoiding this one movement pattern. Maybe they're avoiding flexion, which is like, you know, bringing your head and chin in like this. Maybe they're only going to extension to avoid certain movements. What do I specifically need to do? Where do I need to put my hands? What exercise do I need to do for this specific season of this child's life? And without like an online consultation, or having a physiotherapist, if you're international, or a physical therapist in person, it's very difficult to tease that out. Because like Brita said, you know, I use metaphors too, and I talk about kiddos being an onion, and it could be multiple things that are impacting the way the body moves in order to achieve this complex movement pattern, like rolling multiple planes
It's
of
so
movement.
complex.
so
So
complex. So I just love the fact that, like, okay, you're a parent, you have questions, you don't have to do it all yourself. There are people like pediatric physical therapists who literally, it is our greatest joy to come into your home, teach you how your child is moving, and you can sit on your couch with your coffee, you can get on the floor with us and play with us, you can, like, I can do something and then you can come in and do that same thing, so you're really confident in carrying these things out.
Exactly. And I think for parents, being in that, like, their comfort zone is helpful for them and for baby to be able to be like, oh, yes, I can set them up exactly like this with our piece of furniture and our toys, and it'll happen in the mornings when I'm having my coffee, because this is exactly like our normal day-to-day routine. And obviously for a baby, they're not getting all dysregulated being in the car seat for a long drive and getting in and out, and then they have to get a diaper change once they get there, and then now we're late on my next feed, and then they're starting to get tired, but they're not in their sleep space. And so it just, while I am offering clinic visits at this point, I will never give up the home setting because of just all the benefits that it offers, especially new families. Most of the babies that I work with are under 6 months, and they don't have a schedule or a predictable routine to be able to easily get out of the house at a certain time. Do you know what I mean? And so it's just really helpful across the board to offer that for families.
Absolutely. And so you say you treat most of your kiddos are under 6 months. What is the earliest? So say there's like a mama and they're like, okay, my baby is, hopefully you're not Googling or on YouTube, like in the hospital when you're giving birth. But hey, maybe you're in labor and you're trying to get a head start. You're a really ambitious mama. But okay, so maybe they're like, well, what is too young to call a pediatric physical therapist?
I mean, honestly, I would say it's never too young. Most families, if they're super proactive, find me like around 1 to 2 months. 2 months is a big one because there's that pediatrician visit. Babies are starting to actually move a little bit, and so you can start to notice more movement asymmetries. I really love for them to find me then and not wait till the 4-month visit, which is what most pediatricians will tell them to do. But I literally had a family text me today that has a 10-day-old. So because I have found myself in the TOTS, tethered oral tissues world, I'm seeing them earlier and earlier because people are picking up on babies' difficulty moving because it's relating to feeding, right? So like the 4th trimester, those first 3 months, like when you're bringing baby home, truly that is like 100% of your energy, I feel like, is given to just like keeping your baby alive and feeding them. And when there's a issue there, that automatically comes to the forefront. Whereas how well my baby does in tummy time or whether or not they're moving their head side to side may not be in the front of your mind until you kind of come out of that haze, maybe feeding's going better. And then you might mention at the 4-month visit, like, oh, what do you think about this, like, to your pediatrician? But if it's a feeding issue, that's something you're going to start addressing earlier. So I'm getting babies younger and younger now.
And I know you mentioned this tethered oral tissue for everyone. This is a great book. I need to like read it. I know. Do you have it right there? Oh, we're twins. That's so cute. But the biggest
bookshelf. I've got another TOTS book. I've got.
You'll have to send me those.
This one.
So that's something that's like a total side note. That's really cool. When you own your own business, and like Brita said earlier, she's cash based. So she, her families pay her directly. It allows for a slightly more open schedule at times because you're able to A, treat the families the way you want to treat, but B, you have the space and the breathing room to be able to continue to be an expert in your field and to be able to research these other areas that you are seeing pop up with your kiddos, or even just areas you're passionate about, or areas where you're being a detective and you're like, okay, I've tried a bunch of different things, but this is popping up again and again and again. I know enough to know when I have a skill gap, I'm going to remedy this as quickly as possible because my families deserve the absolute best.
Yeah. And it is such a personal thing for me because I don't know if you've seen anything I've posted this week on my Instagram, but my own child has a tongue tie and he's now 8 years old, but we are still struggling with it. But I didn't have that skill set 8 years ago, and I really wish that I did because we unfortunately didn't have the support that I'm really passionate about helping families get now, because I've experienced the flip side of that, of what happens when there isn't somebody there to help them connect the dots and get to see all the correct people and really validate that, there is something that we can help improve this situation. You don't have to just like keep slapping a Band-Aid on it or keep upping the reflux medication, keep using your nipple shield forever, like you'll be fine, which is like literally things that went on with me and my son. And so I just started to keep hearing these same stories from my families. And I've been treating torticollis since I graduated PT school. So obviously I've been seeing babies with restrictions and tightness. And then I just kept hearing over and over what sounded like what I went through with my son from these families because you're in their home, you're hanging out with them quite a bit. You just start to hear everything, right? We become very close, you become friends. And so that light bulb moment went off for me a while back. And I was like, this is where I need to go, because I not only have that, personal experience, but I want to be that connector for these families. Even if I'm only one piece of the puzzle, I want to be the person that helps them find the perfect support system. And like, I have networked my butt off for the past 3 years to find like all the best people. And that's what I want to be for these families, is like, they might see me first and not even know that tethered oral tissues are part of the picture. And again, I'm putting my detective hat on, and as I'm asking questions and doing my evaluation, I am the first one to even mention that to them. And then I'm like, okay, great. So here we need to go down our list. I need to send you to my lactation consultant, to my dentist, to X, Y, and Z. But I really do enjoy being that connector for families, because I realize how hard it is when you're struggling and nobody's validating that or helping you get to the right place.
Well, and just because struggles are common doesn't mean that there isn't solutions for them or ways to make those struggles either lessen or go away completely. If someone is struggling and it's a common struggle, and then we don't have the skills or the knowledge to give them the solutions, but those solutions do exist, we are by default doing a disservice to these families. And so I commend you for being, in the Denver area, being an expert in tongue ties and lip ties, and also knowing when to refer to these other experts, and then also being able to walk your families through making the appointments, or okay, this is what you're gonna expect, or what you want to know before you get there. This is what to expect at the appointment. If you have any questions on XYZ, you make sure to text or call me so that we can walk through, because sometimes healthcare anxiety is totally a thing. And we, even as people, adults, parents, we can avoid making appointments just from the sheer overwhelm of what is required of us in order to do these next steps. And so there is, it's difficult when you know what those next steps are, if there are a lot of steps involved. And then it's difficult if you don't know what any of the steps are and you don't have any access to anyone who knows what the steps are. So there's two versions of hard, but when you have somebody in the middle who can help guide you through that process in a more gentle way, I think it makes all the difference for these families.
Yeah, I mean, I have my dentist on speed dial. We text daily. So I am literally walking out of an appointment saying, I'm sending you a kid right now. They're going to call in 5 minutes. And and we have that rapport. And the same goes for, so, with a lot of the babies that I see with torticollis, tethered oral tissues, the other third thing that often comes with that is our head shape and plagiocephaly, head flattening. And I have my go-to amazing orthotist who does my helmets for me, because the reality is my passion is trying to keep babies out of helmets and intervene early and work through it with physical therapy and repositioning. But at the end of the day, that's not possible in every case. And so I want, when I send a family out for a referral for a helmet, for them to not feel like they are just being sold something for the sake of, selling, and that they understand the objective data being given to them and the evidence behind that and how that compares to, the norms for their baby's age and gender. And then she talks through, well, this is how babies' skulls grow. And this is the amount of growth we can expect in the midface. And here's the amount of growth we can expect in the, occipital posterior area. And she is just so knowledgeable that my families leave there being like, oh my gosh, I learned so much. And even if they do end up needing a helmet, they feel so, informed in terms of making that decision instead of scared, because it can be scary making that decision to go down that route to put a helmet on your baby. And so in that same realm of just working really hard to create a good network so that my families feel supported when they need extra care outside of what I'm providing.
I think that's amazing. And honestly, having someone who you can refer and then feel confident that those families are going to get in early versus just calling and making an appointment and then, maybe it being 1 to 2 months. I've heard even, oh, we called and they can't get us in till, the end of the month. And then they said it was once we get the appointment, then it's going to be potentially another month. And with cranial orthosis or helmets, time really is of the essence. You have, up to 18 months to really get an effect from the helmets, but there is optimal points in head growth that if you can get them in early within those time frames, your experience as a parent is likely going to be better and more ideal. So having an expert who also knows the other good experts in the region can be a total godsend to the families of Denver. So I know I'd be calling Brita if I'm a mom in Denver looking for pediatric physical therapy. And Brita,
even if they want me to tell them, oh yeah.
So if you guys don't know, Brita and Progress Through Play was voted the #1 pediatric physical therapy in Denver?
Yeah, the Colorado Parent Magazine just does their family favorites issue once a year. So I was pretty proud of that. Yeah. I've only been around it'll be 3 years at this winter. And so for a fairly new company, I felt like that was a pretty big achievement. But I think it's a testament to, thank you, just the amount of quality time I get to spend with my families. And so I am creating that connection with them. And so they feel like they are truly getting a lot of benefit from it, just because of the nature of how I'm able to provide my services.
So there is a mama, and she is in Denver, and she is Googling right now, pediatric physical therapy in Denver. Or maybe she's Googling best pediatric physical therapy in Denver. And you pop up. How does a mama go about scheduling with you and things like that? I'm going to pop over to your website because I got it up. Right here, but if you could walk us through. Okay, so she has found your website and she's like, all right, this Brita girl, I want her to come to my house and see my 2-week-old. we're struggling with feeding, but I've also noticed maybe some flatness on the head, because mamas of YouTube, if you didn't know, flatness can occur in utero. And so doctors, pediatricians, nurses should all be screening for any signs of asymmetries in head shape or any flatness when you're in the hospital, and then 2 days after the hospital, and then definitely within that first month of life.
Yes, absolutely. So I like to give my families several options because I know, I don't know, definitely in the millennial generation, you want to be able to just like click through. I don't want to have to make a phone call. Um, so
Me
you can
either.
absolutely go directly to my website, click into my patient portal, and just schedule your appointment all on your own if you already know that that's right for you. So what happens is, because I have a little bit of a Instagram presence, families feel like they kind of get a gist of what working with me is kind of like. They feel like, oh, I've seen Brita talk a lot. I've looked through a lot of her content. Like I kind of already connect with that. And it sounds like exactly what some of my pain points are or what I'm looking for. And so in that sense, they feel kind of comfortable going ahead and just scheduling all on their own. And I am happy when that happens because it means it's quick and easy and they get the appointment that they want. If you're not sure, I will do free phone consults. And I actually encourage families to text me as well, because what happens with phone consults, if you just try and call me, I'm most likely in an appointment. And then we end up playing phone tag forever. So you can either go on my website into the appointments bar and schedule a phone consult if you go to book an appointment. And that'll actually find you like a clear spot in my schedule where I won't actually be in with a patient to be able to chat, or you can just text me. So that discovery phone call right there will take you to my availability page. But so I am happy to talk through whatever questions they may have. A lot of times they're like, let me get my husband on too. He wants to know what's going on. And that really can help you make sure that you kind of connect with me and that my services sound like the right fit for you. And then I can just go ahead and schedule you right from there. And oftentimes people even call me and say, I don't know if you're the right person for me, but if you're not, do you know somebody that is? Because I have such, a big referral network in Denver. And I am happy to do that. I love, like I said earlier, connecting people with the right providers for them. And I always want to empower families that ultimately they are the expert in their children. And if you don't feel like you're meshing well with your provider, go get a second opinion. You are in charge of that. And you should always feel validated and like all of your questions are answered when you leave an appointment with whatever healthcare provider it is, whether it's physical therapy, a physician, etc. And so I want to help families find that.
I love it. So you do the phone calls. So the discovery 15-minute phone call, which is awesome. I love that you can just literally schedule it online. I absolutely hate and almost will like weirdly refuse to call somebody. If you don't have like an online scheduling, like the last thing I want to do in my life is call a front desk and have someone be like, well, can you do this time? Oh, well, can you do this time? Like, no, like just show me all of the times available so I can like look at your busy schedule and look at my busy schedule and find the ones that match and then book the one I want. That's most convenient for me.
Exactly. And that's what I want too. So that's what I have.
So I love that. And then you also have, again, those like in-home evaluations and then the follow-up sessions. I see you have some packages too, which is awesome for the families who just, want a little bit of a discount and also are ready to like be like, okay, like let's get a couple of these on the schedule because I don't want to lose that spot. I know you're a super busy lady. And also just like that consistency, right?
Yeah.
But I'm really curious about these virtual sessions because, again, if there's someone who just happened to watch this YouTube video and are like, oh my God, I would love to chat with Brita about like my head shape, the head shape of my baby, but I'm not in Denver. Dang it. What do I do? Well, friends, we've got an option for you. So Brita, will you tell us a little bit about these virtual consults?
Yeah. So I think as physical therapists, we are just natural helpers, right? And so I started my Instagram account. So, like you said, with your YouTube videos, I want to get more of this content out there so parents can feel like, even if they're waiting for maybe PT in their area has a wait or whatever, that they can have something tangible to do. But at the end of the day, my Instagram content is not geared towards your specific situation. And so I created my consults basically just as an extension of that, meaning I cannot do a full evaluation and an assessment of your baby, but it's taking my educational content and tailoring it to your specific situation when I hear kind of what's going on. And then also helping you kind of figure out what the next steps should be. Is this something that, now that I've heard the full developmental story of your child, sounds within normal range and I can just validate, like, here are some fun, purposeful play activities for you to go, have in your back pocket, and X, Y, and Z are any reasons when you would maybe need to reach out to somebody locally. Or, hey, you know what? I'm seeing some red flags here. Let's talk about how we can find you somebody who can meet with you in person. Or, like I mentioned, we have an appointment with early intervention, but it's not for 6 more weeks. Like, what can I be doing right now? And so it's kind of in those situations where you just want to take kind of what I'm already providing on social media, but get it in a more personalized way. And so that's why I created the virtual consults, because again, you just want to be able to help everybody, and I can't be everywhere at once.
Well, and I also think too, because I also do virtual consults, I think there's even a space within, if you're receiving like traditional, like maybe you're going to PT in a clinic, and then, or maybe you're doing early intervention, but you just want a physical therapist to like walk you through the exercise program that they gave you and give you like a little bit more one-on-one feedback. Because I really feel like sometimes in the traditional model, it's really hard to be able to do all of the things, because your business is not based on that. It's based on a system, and the traditional model has its own limitations, where if you own your own business and you're cash based, you can provide a little bit more touch points or a little bit more in-depth information. You're not necessarily like contradicting anything anyone else is saying, but you're like, oh, okay, yeah, this is how you do that exercise. Put your hands here, right. Try this, do these different things. And I think as we continue to evolve as human beings, but especially human beings in the healthcare industry, parents and individuals really want more touch points. They want to feel heard, they want to feel seen, and they want to know that they're doing things correctly in the right way. And they're really hungry for more information and for more knowledge, and to be able to even talk to a physical therapist on the phone, or get online with them and just talk to them and pick their brains or ask specific questions is so needed in the medical system. But in the traditional medical model, there's not really a lot of space or time available for that, because of just how the system's created, where we're a little bit more fluid. And so we can do that, which I think is really cool.
I think it's a lot of filling in the gaps too. And so I've had families reach out and say, you know what, we are seeing a physical therapist for torticollis, but I have a hunch that there's actually some oral motor stuff going on, but my PT doesn't seem to specialize in that. Can you kind of help me figure out if this might be something that's contributing to my baby's situation? Or we only have one option for a orthotist who does helmets in my area, and I just really want to bounce this off somebody before we make that decision about what do these numbers sound like to you? Does that sound like, it would be a good choice for us and our family? I can be that sounding board, right? If you don't have access to somebody with that knowledge in your area, you deserve that, even if there's not somebody down the street. If you don't live in Denver, I want to help you walk through those decisions, and that it's a tough decision to make, or just kind of help guide them along the way. And so I will readily say I have a lot of gaps in my physical therapy knowledge, because I have specifically specialized in one area. So if an 8-year-old walked in my door, I would say, okay, I can maybe get you started with a couple ideas, but then I am going to send you off to somebody else because I'm not the appropriate therapist for you. So if you feel like for some reason the clinician you're working with may have a certain gap, or you just don't have access in your area where you live to any pediatric therapist, or if there's long wait lists or anything like that, that's what I want to kind of help fill the gap in.
One thing I did want to talk about for that is your courses, because this is something that I would love to see more physical therapists do. And really just kind of, like you said, maybe you found her on Instagram and you've got some information, but you're not quite ready to schedule an online consultation. You're like, I feel like there's, I wish there was like an in between. Is that where is that where you would send people to your courses?
Yeah, it's a good entry point. If you already kind of know, I just want to know about rolling. Like, how in the heck does a baby learn how to roll? Like, I don't even know the mechanics of it, what body parts they need to move, what precursor skills there are. Like, how does that happen? This is a good place to start. I love rolling. Rolling is my favorite milestone.
I love rolling too. Because here's the other part too for families. If you have a kiddo who struggles with rolling, crawling is going to be a beast most of the time. And if you skip transitions, right. So I talk a lot in my videos about the different planes of motion. So you have like the side-by-side plane, you have the front and back plane, and then you have the rotation plane. When you think of rolling, you really have to rotate your upper trunk on your lower trunk and also kind of do that twisting motion. And so if you don't master that, then going from sitting to bringing two hands to one side to then rotating the pelvis to get into all fours is going to be a little beastly, or it's not going to quite be as smooth as it could have been if we could like rotate or twist our trunk.
Yeah.
Do you have any tidbits to add since you love rolling so much?
No, I just feel like because it's such a complex movement, like you said, it utilizes so many different parts of the body that if they learn how to move and coordinate well that early on in that 4 to 6 month range, it just sets them up for success down the road. Like I said, when I'm working with families on these earlier skills, I'm always talking about how helpful this is going to be for X, Y, and Z down the road, our transitions, our crawling. And I just see the repercussions of kiddos who don't get that experience of rolling early, and then they turn into my happy sitters, and then they don't crawl, and then so it kind of snowballs a little bit because these skills are meant to build upon each other. And not that every baby is going to meet them in the exact same order and in the exact same time frame, but there is like a purpose for each thing.
Absolutely. And the other thing too is like you think of like walking is every parent wants their kiddo to walk. So if we're going to pick any milestone, I feel like walking is the one that gets the most glory. But in order to walk, your pelvis needs to rotate. And if you aren't rolling and you aren't crawling, that pelvic mobility doesn't have the chance or the opportunity to develop in the way that it's meant to. So then, okay, maybe you're sort of walking in a little bit of a sticky manner, but then is jumping going to become more difficult because you don't have that play in your pelvis. It's not moving in the patterns that it would have been, or moving in the ways that it would have been had you developed those earlier patterns.
Yeah. And parents are like, why are you like tilting my baby's pelvis in tummy time and doing this? And I'm like, oh, just you wait. I will show you why this is so beneficial. But these courses are just, basically dipping your toe in the water, not necessarily entry level. They're comprehensive in terms of talking about kind of typical development of how, like you said, the mechanics of how is a baby going to get from just being flat on their belly to a total roly-poly of being able to go all across the floor, or how is my baby going to go from just pulling up to stand to walking, and just understanding the pathway that kiddos take to get there. Then if your kiddo might need a little bit extra, or you feel like you're troubleshooting left and right and you need some more help, that's when you would transition into an actual appointment with me.
Awesome. I love it. Britta, is there anything else on your website that we didn't get to that you would really love to highlight?
Those are the big ones. I'm so active on my Instagram. So
Yeah,
I think that is honestly a treasure trove if you're looking for more content. I mean, I do have some blog posts and stuff on my website, but truly the meat of the content is on Instagram.
and you really do. You really highlight kind of those areas. So tummy time, torticollis, tongue tie, head shape, those kind of pain points that families might be having, and then also where you're focusing the most of your intention and expertise in helping families navigate. And then also, I love that your business name, Progress Through Play, is so focused on the play part, because we want parents to really feel comfortable in their baby's development. But the reason why we got into pediatric physical therapy, I mean, if I'm being honest, is because it's so dang fun. Like, play is so important, both for us as clinicians, obviously the baby, for their development and their cognitive development, and then also too for the parents, because we don't want this season of life to be stressful. We want to help make it better and make it more fun.
Yeah. I mean, I got the feedback today from a family, and I love it when everybody's involved. It was grandma who has been helping out, take care of the baby as mom and dad are going back to work. And the feedback was like, you just seem like you enjoy yourself so much. Like, you really, it shows how much fun you have, and just like, it seems like you really enjoy your work. And I said, truly, I cannot imagine doing anything else. If I could have had 100 more babies of my own, I would have, but because two was plenty for me and my own mental health. I'm just gonna go and love. Yes, I'm just gonna go and love on everybody else's, and it's truly why I started out in pediatrics, treating the entire birth to 18 or 21, even in some cases, and throughout my career have totally niched down to our youngest because I love it so much. So
I mean, and it really can change families' lives. Like, it really, really can. And so I love all of your content. So I'm gonna have to go in, because I'm still learning about tongue ties. And for everyone out there who's listening to this and is like, wow, I feel like Britta talked a lot about tethered oral tissues or tongue ties. The reason why she's talking about it so much is because A, it's such a big part. B, we're still learning so much about it. And then C, like, in our group of pediatric physical therapists, Britta is one of the experts that us other physical therapists go to learn more about. So if this is a concern, or you're just curious, like, what even is that, definitely go to her Instagram, which will be linked in the description, but you could also search Progress Through Play. It'll pop right up. Because I mean, I'm saving stuff, right? Like, I'm watching these things, saving them to my own Instagram, and then forwarding that on to my own families, because even just having huge content in that area is so helpful.
Well, and in the world of pediatric physical therapy in general, we are newer to treating babies with tethered oral tissues. It's not something that we were taught in our doctorate programs. This is something that I have specifically sought out extra training in, and there are not a ton of physical therapists in that world. And because we are so good at analyzing movement, that is truly at the core of everything that we do, is looking at quality and improving, getting optimal function of the entire body. We would really be remiss if we stopped right here. Do you know what I mean?
Right.
And there are adult physical therapists who work on TMJ and who work in the mouth. And so why for all these years were we not doing that on the pediatric side? And when I thought about it, I was like, well, physical therapists work internally on the pelvic floor. Physical therapists work on adult TMJ orally. And I was like, why can't I become an expert in that for infants? And it just made total sense, because it helped me connect the dots with everything I was doing up to right here. And I don't want to leave any stone unturned when there's potentially something going on in the mouth that is causing issues, what we call down the chain, because of compensations or, functional issues. So anyways, I'm just super passionate about it and excited. And I am still constantly learning more and more about it as well. But I just think it's awesome that more and more PTs are getting interested in it and seeking out training and seeking out knowledge. And we're creating these great groups of professionals who are, passionate in that area.
I love it too. And I love that there's so much. So for the families of YouTube too, is like if you have tension in the front of your mouth that is pulling you down, try even like opening your mouth with your chin close to your neck, right? This is an oversimplification of it, but like my mouth doesn't open very much if I am tilted down. But if I have the relaxation through my neck and through my oral tissues and my mouth, and nothing's like holding me clenched in this position, I can open my mouth so much wider, and having a more open mouth and a little bit of that head extension then makes feeding so much easier. It makes moving so much easier because you're not like trying to like move around like this, right? Like you're relaxed. You can bring your shoulders down. You're not like pulled inward.
Absolutely. And I think if there are any providers watching this or pediatric physical therapists watching, I think for so long it was kind of like, oh, well, the mouth is OT, occupational therapy, or speech. They have like, the monopoly on the mouth, and anything going on in the mouth, we don't even want to look into it. We're just going to send them off. And there's room at the table for everybody in, this continuum. And I often work closely with occupational therapists or speech therapists to help these babies. Sometimes it is outside of my expertise, and I say, I have reached my limit in terms of my knowledge of oral function. We're going to get you to this next person. Or we're simultaneously working, or maybe babies reached a point where they're eating solids. And then I'm like, okay, I'm out. I am not a feeding therapist. We're finding somebody who can work on that skill, because that is not something I even want to dive into. So again, if you're a pediatric PT and you've been kind of wondering about it, but you're kind of stuck in that older view of the mouth being, not within our scope, I think you need to kind of rethink that, because there's room for all of us there.
And honestly, as women, right, we want to bring more women in to areas where we can serve more and then also learn more. And so just acknowledging that we do have a seat at the table is huge. And also that like the other disciplines are probably like the more the merrier, right? Like if you know where your skills end, you know where my skills begin at a certain point. I love sharing everyone else's business because I'm not capable of treating every child on the face of the planet. Like I need to sleep and take vacation too. So knowing that there are other great therapists out there that can bridge different gaps and have different availability and have different skill sets, but that we can all overlap each other, I think that results in better care overall.
Absolutely. Yeah, we all need to sleep and take vacation.
Mamas too, right? Mamas too.
Yeah.
Awesome. Well, Brita, it has been an absolute joy having you on the channel. Is there anything else you want the mamas of Denver to know about pediatric physical therapy or progress through play?
I would say just don't be scared to take that first step and reach out. Like we were talking about, like I want to just be able to click through. I don't want to talk to anybody on the phone, but I am so accessible, I feel like. And I think just taking that first step can sometimes seem daunting. And so I do a lot of community stuff too, because I feel like meeting moms somewhere where they're already going to be can be helpful so that they can kind of get to know me, lactation support groups and mommy workout classes and all the things. So you may run into me out in the community somewhere, but if you don't hesitate to kind of just take that first step to reach out, because I'd love to chat.
Well, and truthfully too, I feel like even just getting a physical therapist or a pediatric physical therapist on the phone, we just want to share all of our knowledge. And so you might walk away from a 15-minute phone call with 2 or 3 really actionable steps or pieces or nuggets of knowledge that you can implement right away without even having to pay a dime and without even having maybe scheduled an appointment. But you're like, okay, like I have a place to start. And then you can have that confidence to maybe take that next step if that is what is beneficial for your kiddo.
Absolutely. I agree.
Awesome, Brita. Well, thank you so much for joining me on this interview, and it has been an absolute blast.
Thank you, guys. Thank you for having me.